Hello, my name's Taylor Lehmann. I'm 24 years old. I was diagnosed 2 years ago, February 4th, 2016, with non-Hodgkin's lymphoma while I was 21 weeks pregnant with my third child, my baby boy. The purpose of this video is to share my experiences in battling cancer, especially while being pregnant. I want to give insight to others battling cancer, especially others like me that were diagnosed while they were pregnant. I want to let everyone know my experiences that I had while going through cancer treatment while I was pregnant. I know that while I was going through the treatment, my number one concern was not just for my life, but for my unborn baby's life. I was so worried that something was going to happen to him, that he wouldn't make it. There was not much research that I found of other women in my situation that were treated for cancer while they were pregnant. So that's my main purpose of this. I want other women that are diagnosed while pregnant to not be as scared, and I want them to see my example and see how it turned out really, really well, and how I had a perfectly beautiful full-term baby boy. Alright, so it all started with these symptoms that I was having. Like I said, I probably got these symptoms around, I started getting, when I was 12 weeks pregnant, I started feeling this tightness in my neck, especially whenever I lay down. Almost felt like if you are doing a handstand, you feel like the blood rushing up to your face. It wasn't that bad, but I felt that weird feeling. And it was only when I laid down, and I brushed it off at first, thinking it was just, maybe it's because it's a boy, this pregnancy. My other two are girls. Didn't mention anything to the doctor yet. A few weeks along, I started getting more intense symptoms of the blood rushing down, or the blood not being able to drain out of my face is what it felt like. And that's exactly what it felt like. I just started getting this really scary feeling every so often. My symptoms started to get really bad around 18 weeks pregnant. I was going to school for nursing, and I was still pumping breast milk for my daughter, who was she was younger than 1. And I was walking around campus carrying my pump and my book bag, and I remember just getting so out of breath so easily, where it felt like I was truly going to pass out, and I would get that same feeling of the blood not being able to drain out of my face, and my neck would just feel like it was bulging. And I remember whenever I would eat, it felt like the smallest bite of food it felt like it was getting stuck in my throat, and it was really scary. But once again, I thought it was just pregnancy symptoms. I was going to the doctor, my general practitioner. I went to her a few times and told her my symptoms. I told her it felt like I had superior vena cava syndrome, which is a syndrome where the blood literally can't drain out of your face, and because the vena cava is blocked by something. And she told me, no, not at all. It's not that at all. She said that my eyes would be sealed shut because it'd be just so full in my face. So I was like, okay, well, I guess that's good. It's not anything too serious. She told me it was pregnancy symptoms. I also had this weird bruising right around here, and I showed her that, and she said she's not worried. She said it's just capillaries from pregnancy. And the scariest thing that I had, so I went to her at least. This is probably the third time I went to her and told her these symptoms are not going away. Like, it's getting bad. I'm almost passing out at work. I can't carry anything because I feel like I'm going to pass out. I started to have people need to carry the smallest thing, like a plate for me, because I couldn't carry it because it would put so much strain on my neck. But the symptom that I brought to her that was the scariest was I had one lymph node on my neck, only one side that was popped out. So I went to her and I told her that I'm having those same feelings, and I've got this lymph node now that's weird. She didn't even feel it. She just told me I'm not worried about it because it's only on one side. If it was both of them, then I'd be worried. Told me again it was pregnancy. She made me feel like I was being a baby, just being a pregnant baby. And I told her, well, what do you want me to do, because I'm going to pass out. The next time this happens to me, one of these times I'm going to pass out. And then she's like, okay, well, since you're worried you're going to pass out, I'm going to refer you to this cardiologist. And you let them know that you feel like you're gonna pass out. So I ended up getting into the cardiologist's office the next day. And when I was sitting in the waiting room, I was just thinking, I started to get embarrassed because I was thinking, I'm overreacting to all these pregnancy symptoms. They're gonna think that I'm just crazy here. I'm just wasting everyone's time, wasting money on co-pays. And So yeah, my husband and I were sitting in the waiting room, got called back. We're joking in the office waiting for the doctor because we just don't think it's serious. We're just talking about what we're going to do after this. And he comes in and introduces himself. Super nice. Super nice. And he immediately notices, he stares at me in a weird way and asks me, like, he says he sees something weird on my neck, and he says it looks like my veins are bulging out of my neck. And he said that's not normal. He took my blood pressure, like, it felt like 3 times he took my blood pressure, and he listened to my heart for a while, which was weird. Like, he was looking for something, and he asked me if I ever had any heart murmurs, which I've never had in my life. And he said he heard multiple heart murmurs. So that's super scary. And then he goes on his computer, and he told me he doesn't like what he's looking for. And that totally changed the tone of the office visit. I started getting worried because I don't know what he means. He asked me to lay down because I told him how, I forgot to mention that, I had this horrible cough too that was getting worse and worse. I couldn't sleep. I had to sleep at a 90-degree angle, sleep sitting up, like literally sitting up, coughing and coughing and coughing. And that's another thing. My general practitioner told me that it was bronchitis, and she prescribed me bronchitis medication. Anyways, so he had me lay back, which of course I'm starting to cough like crazy because I cannot lay on my back, and it feels like my blood's can't drain from my face. And I think he looked at the spot on my belly that had a little bit of bruising. And then he listened to more heart sounds, and then he told me, he never told me what he suspected, but he just told me he didn't like what he was looking for. He had me go to a stat blood testing and stat x-ray. And I said, of course, but I was worried about getting an x-ray because I had a baby in my belly. But I went anyways. He told me we need to find out what's going on. So, got my blood work done. Went to the radiology office to get my x-ray. I remember one of the women in there was telling me, you can't get an x-ray, you're pregnant, that's not safe for the baby. And I remember just crying because I'm like, I feel so bad, I don't want to get it done to my baby either. Like, I'm so scared, but I'm also scared that something's really wrong with me. And then the other woman told her to stop. Like, I think that was a little bit inappropriate, and she told her this is what the doctor ordered. So I go and get the x-ray done. They gave me an extra lead vest to try to cover the baby. And the doctor had told me this is at night, this is probably 8 p.m. This is all after hours. They were closing up the radiology office, but they just squeezed me in. So my husband and I are sitting there in the waiting room because he told me to not leave the hospital until he got the results, and he was going to talk to me about it. So my husband and I are sitting down in the waiting room, waiting for a phone call, or for them to call my doctor and my cardiologist. So my husband and I heard the doctor read the results to my cardiologist, and I heard some keywords, but I don't know all the medical lingo. After they made the phone call, they hung up, and they told me, please wait here. He wants to come up here to talk to you. So that just freaked me out. I was just so anxious. I've never been so anxious in my life. My husband and I are just sitting there. I'm uncomfortable because I have all these horrible symptoms. He comes in, sits down, and told me I had a really bad x-ray. He said that my heart was huge. He said I had pericardial effusion. My entire heart was enlarged, like doubled, and it was just inflamed. And he asked me if I have ever heard of non-Hodgkin's lymphoma, and he told me he's pretty sure that's what it was. And I wasn't too familiar of non-Hodgkin's lymphoma, but I've heard of it, and I know that it's cancer. And he told me he's not 100% sure that's what it is, but he said it is most likely cancer. And I remember just crying, hugging my husband, asking if my baby is going to be okay, and I just had so many questions. And he told me that I need to be admitted immediately. And my two daughters were were at home with their grandma and grandpa being babysat for this quick appointment. And my husband had to call my in-laws and let them know that I was being admitted, that it was something a lot more serious than we thought. And I remember just crying and just being in disbelief, and crying. And I remember went to the bathroom really fast and looking in the mirror, and I could barely breathe because crying made the symptoms worse. My face is just inflamed. You could just see the veins in my neck just being engorged, and I couldn't breathe. Crying was making it worse. Couldn't catch my breath, and I'm just freaking out, just thinking about my kids that I have now at home, and just thinking about my life and my baby. I truly thought that being diagnosed with cancer, I thought that 100% I was gonna lose my baby. And I was already thinking about if I could keep my baby, if I could sacrifice and keep my baby instead of myself. All these things are running through my head. So they admitted me. I met with so many doctors, all types of doctors, oncologists and cardiologists, pediatricians, obstetricians, specialist obstetricians, and everyone was super nice to me, comforted me, and they told me that I was going to get my first round of, they confirmed it was non-Hodgkin's lymphoma after I had a immediate biopsy, super quick biopsy. They confirmed it was non-Hodgkin's lymphoma, stage 2. It was really bad. Everyone was super impressed with the size of the tumor. They didn't understand how I haven't died yet. They told me that I it could have easily been dead already. Me and my baby could have just passed out right there. The enlarged heart and pericardial effusion was due to an enormous tissue that was my entire chest, surrounding my heart, squeezing my superior vena cava. That's why I got those symptoms. It was squeezing that vein, literally where the blood goes back down to my heart. It was so squeezed that the blood couldn't even drain back to my heart, and that's why I had those horrible symptoms. That's why I had that cough. It was squeezing my lungs. I also had little tumors in here in my armpits, and I had tumors in my neck. So I was misdiagnosed by my general practitioner multiple times. I went to her with my symptoms. I could have died from being misdiagnosed. I mean, it's not just that doctor's fault. I understand mistakes happen, but I just can't get over that. I think that's just so crazy. I knew something was wrong, and I should have just trusted my gut that something was wrong, and now I know. But so yeah, got my first round of chemo while I was pregnant. I was so scared that it was going to affect my baby. I was reassured by many doctors that the baby should be okay. I had to go through a whole course of treatment before I had the baby. 5 rounds of R-CHOP chemotherapy every 3 weeks, once a week every 3 weeks. And I remember just researching like crazy, being pregnant with cancer and getting chemo while being pregnant, and the effects on the baby. And all my doctors just told me that they said there wasn't enough research, but they didn't think anything was going to happen to my baby. They said that the biggest threat is that he'll be born early, premature. So I was admitted to the hospital a few times after this, and each time they'd bring in that baby warmer kit, and it was just so scary because I was like 20-something weeks pregnant, and babies don't have a very high chance of surviving that early, you know. But anyways, my entire pregnancy with him, I was so worried that I was going to go into labor early, or just worried that he's going to come out and something's going to be wrong with him because of the drugs that were put into my body, you know, to kill cancer. I mean, I lost all my hair within 14 days after I went through my first round of chemotherapy. And it just making me think, I'm losing my hair, I'm losing my eyebrows, I'm losing everything, and what's happening to my baby? What are the effects on my baby? My doctor, one of my oncologists, told me that the placenta is protecting him against the chemotherapy, but it still worries me. I mean, you're not supposed to drink alcohol. You're not supposed to do all these things. You're not supposed to take certain medications while you're pregnant. And I'm taking chemotherapy, a poison, and I'm pregnant. So I spent countless hours researching effects of chemo on a baby and all this stuff, and I could not find anything that would reassure me good enough. I found barely anything, so I really thought that me making this video would help and inspire others, because I ended up going into labor after my 5 rounds of chemo were done. I even rang the little chemo bell when I was done, because I thought that that was going to be the end. I thought that I was cured after that, you know. So I got to ring that while I was pregnant. Everyone, I made so many friends, all the chemo nurses, everyone was so nice to me. I became so close to all of them, and everyone loved my story because I had a baby, you know, pregnant. It was just a rare thing that happened. I ended up going into labor at 37 weeks pregnant, which is just exactly full term. So he was not premature at all. 37, went into natural labor. I had no epidural. I was 100% drug-free delivery. It was awesome. Of course it hurt, but I had him. I was able to get up and walk around right after I had him, and it was just beautiful. He came out beautiful. He was perfect. He was absolutely perfect. Nothing wrong with him at all. I didn't do any epidural or anything during my delivery because I felt like I had so many drugs in my body while I was pregnant with him. I wanted this to be a pure delivery. I thought that I can do this for my baby. I don't need any painkillers or anything. I can do this for my baby. He deserves to have a drug-free delivery. That's what I thought was my mentality. But I did it. I had him. He turned out to be perfect. Nothing was wrong with him. It was awesome. It was just a beautiful delivery. He turned out to be perfect. His birthday is May 22nd, 2016. He is almost 2, and he's beautiful. He's perfect. He's just perfect, and I am so thankful for him. Even if the worst happens to me, I'm just so thankful that I was able to have this perfect baby because of these circumstances. So yeah, I just wanted to share that with anybody that that knows anybody else that has cancer, or especially cancer while they're pregnant. If you yourself are a cancer patient and you're pregnant, I wanted to give you some inspiration that it's going to be okay. The baby will be okay. I want to give any advice. If anyone wants more advice or has any questions for me, I'd be happy to give you my personal cell phone number if you ever want to talk. I just want to be there for somebody. I wish that I could have had that when I was going through everything. I wish that I could have had someone to talk to relate to ask questions to, and that would have helped me a lot. So if anybody has any more questions for me or wants more advice, I can make another video. I can talk to you privately. After I had my baby, I thought I was done with cancer, but it turns out I wasn't. It was actually considered refractory after that because it barely even reacted to that chemo. It was a lot worse than what they thought. It came back bigger. So I had to go through a lot more treatment after that. I will make another video and explain all that I went through. But yeah, I just, let me know if you're interested in another video or you have any questions and if you want advice, and I will be happy to give you my number or post another video. Thank you so much for watching. And I'm gonna put together a quick little slideshow at the end of this and show you different pictures of what I went through. Just pictures of me being pregnant, fighting cancer, and picture of the baby at the end, and show you how perfect he really is. All right, thanks.